Come in. Hi, I'm Jeffrey. I'll be your student
Hello,
nurse.
nice to meet you.
All right. Can you have a seat for him, please?
Gotcha.
All right. As he walked in, I assessed his gait. He had a normal, steady gait. When he sat down, that assessed his cranial nerve 2 visual acuity. He was able to come in, orient himself, and find the chair and sat down. He heard me talking and talked back. That assesses cranial nerve 8 for his ears, cranial nerve 10 and 12 because he spoke back, and he smiled, cranial nerve 7. That's the facial. And also, as he walked in, I looked at his skin and assessed for hygiene, color, any visible abnormalities. Okay, and then I'm going to ask him a few questions now. Do you know who you are?
Yep, Jansen King.
Okay. Do you know where you are?
I'm at your house
Do you know why you're here?
to make a video.
Do you know what day it is?
It is the 19th.
Okay. He's alert and oriented times 3 because today is the 20th.
Oh, man. Okay, you got it.
All right. Now I'm going to move on to check his vital signs. I'm going to start with his blood pressure. Okay. And while I'm doing this, I'm going to check his temperature. I'm going to have him put this underneath his tongue and shut his mouth tightly. Okay. Okay, very good. So it's 105 over 62. That's very good, very good. All right. His temperature, 98.6. Good to go. All right. Next, I'm going to assess his respiratory rate. All right. While I'm doing this, I'm also going to have him put his arm across his chest so I can, do his pulse and his respiratory rate at the same time. But in a normal setting, you wouldn't let the patient know that you're doing this because you wouldn't want them to change their respiratory rate. All right, his pulse is 66, which is within normal range, which is 6,200. His respiratory rate was 16. It's also normal. Okay. Next, normally I would do a pulse ox, but we don't have one here now. But normally you put on your finger to get a oxygen saturation, right? Percentage. Normal range is 95 to 100, just depending on the person. There's different normal ranges for everyone, depending on what disease processes they have. I'm going to ask him if he has any pain today. Are you experiencing any type of pain today?
No, sir.
No. Normally, if he does have pain, then I would then follow up with an assessment with using old carts and ice. And then I would also ask him if he knows his height and weight. Do you know how tall you are?
5'10" and a half. And I weigh
How much
160
you weigh?
pounds.
160 pounds. Okay, that also assesses. That's 1, 2, 3. Okay, and I have all of his vital signs. I'm going to move on to his hands. I'm going to take his hands and I'm going to assess them for symmetry, for skin turgor, cap refill, less than 2 seconds is good. Okay, I'm also going to assess the overall appearance, clean and hygiene, color, shape. Okay, and I'll have him put his fingernails together to assess for clubbing. Can you just put your fingers like this for me, please? And you're gonna check for the angle of the nails, and that clubbing is caused by chronic hypoxia. So this proves that he hasn't had issues of hypoxia because his angles are normal. Okay, and we're going to move on next to our head to toe assessment. I'm going to move him now to the couch. All right. Now I'm going to start by assessing his skull for size, shape, symmetry, any type of abnormal lesions. Okay, I'm going to palpate his skull all the way around. Okay, everything seems to be normal, and at the same time, you're going to be checking his hair for strength and color. Okay, and growth. Everything seems to be normal. Okay, I'm going to move down here. I'm going to check his temporal arteries for a pulse, and the rate and rhythm is normal. You're going to observe his facial structure for any type of abnormalities in symmetry or color. You assess his skin. You're also going to assess. You're going to assess his facial bone structure. Okay, and then you're going to palpate his sinuses, his maxillary here, and then for any type of tenderness, you're going to palpate the frontal sinus, and then you verify with the patient. Is there any tenderness?
There's no pain
Okay.
there.
Next thing you'll do is check. Go down further and check his trachea midline to see if his trachea is in line. You basically just follow it down, find it with your fingers, move it side to side. Okay, and see if it's in the midline. You ask him to swallow. Can you swallow, please? All right, and if he swallows normally, and you can feel movement while he's swallowing, that's cranial nerve 9 and 10. And then okay, and then you're going to do his carotid pulse, one side at a time, so that you're not occluding oxygenated blood to his brain. Okay, pulses are good. All right, next thing you do is we're going to assess his eyes. Okay, we're going to do first. We're going to verify perla, pupils equal, reactive, and round. Pupils equal, round, reactive to light and accommodation. Okay, you're going to ask them to stare straight at you. You're going to take the light, and first you're going to check for consensual restriction. Okay, on both sides. All right, that's good. Uh, then you're going to do accommodation. Have them follow your finger from a distance into their nose. And what you're going to be watching for is their pupils to constrict and dilate. And that's good. So Perla, the patient is Perla. Pupils equal round reacted to light and accommodation. All right, now you're going to do the cardinal fields of gaze. You're going to start, I'm going to use what they call the wagon wheel method. You start at the middle, you go up, to the right, and you're going to go to the right, you're going to go down to the right, and then the opposite direction. Okay, and what that assesses is cranial nerves 3, 4, and 6. 4 goes down and inward, 6 goes out, and then 3 is everywhere else. Okay, and at the same time while I'm doing all of this, I'm going to assess his eyelids, his palpebral fissures, and his eyebrows to see if there's any abnormalities, check the growth of hair, the symmetry of his eyes, and then I'm also going to look at his cornea, iris, pupil, to see if there's any tears or anything in his eyes. Okay, as far as eyes go, I think I'm done with that. I'm going to move on to the ears now. I'm going to palpate his ears for any nodules or lesions or anything. And I'm also going to look in his ears to see if there's any discharge. Okay. See, that's good. Temperatures and everything is good on this. Okay. And then I'm going to palpate his lymph nodes to see if there's any abnormal swelling. Okay, I'm going to start with the preauricular. It's up here. The parotid is right below. Postauricular is behind to the top of the ear. And then you're going to palpate the occipital. It's on the back of the head. Next thing, you go down here to the jawline where you'll get the tonsillar. And then the submandibular, a little bit further down, sublingual. And then right at the tip is the submental. You're going to palpate the anterior superficial cervical chain. A little further back is the deep cervical chain. And then further back from that is the posterior cervical chain. That's also superficial. All right, and then in order to palpate the last one, you need to have your patient shrug their shoulders and then move their chin to the side that you're going to palpate. Okay? You just shrug your shoulders and move your chin to the right. And you're going to palpate right here on top of the clavicle in the little pocket to see if the nodes are swollen. To the other side, please. Same thing on this side. All right. Next, we are going to check his nose, mouth, and throat. Okay. We start with the nose. Ask them if they have any problems with smelling. If they do, we're going to do the smell test, which is you're going to close their eyes. Have them close their eyes and include one nostril, and give them smells to identify. Okay, and then you're also going to look into their nostrils to check for symmetry, check for color. You want to look for a deep pink color. You want to make sure his turbinates are not swollen. You want to make sure there are no polyps. And you can also assess hygiene and mucus. Now you're also going to have, we're going to move on to the mouth, and we're going to check the mucous membranes to make sure they're not dry. Okay, you're going to look at the hard palate and soft palate for a deep pink color also. You're going to have the patient say ah, and watch for the tonsils rise and fall, and the uvula also. And you're going to have them put their tongue to the roof of their mouth and look at their salivary glands, the opening to the salivary glands. Now, I'm also going to have him take his tongue and stick it out and point towards his nose, and then point towards his chin, and then side to side. That's to assess cranial nerve 12 for the, I think it's the glossopharyngeal. All right. Okay. Next is the upper extremities. We're going to assess range of motion for his upper extremities. So I'm just going to have him stand up here. Okay. I want you to take your arms and raise them up to the sides, please. That's abduction. And put them back down. Adduction. Okay. And then we're going to do shoulder range of motion. This is for his shoulder. Is bring your shoulder to the front and in. That's adduction, and then to the back. Now that's abduction. And then put his hands out like this, and then there you go. And that's going to be supination and pronation of the elbow. We're going to now test his bicep and tricep strength. Bicep strength, I'm going to have him pull towards him, okay, and now push against for tricep. All right, now I'm going to test his grip also, and put 2 fingers out and have him squeeze as hard as possible. Grip is good, even. And then I'm also going to feel and palpate his arms for any nodules or lesions or anything, any abnormality, and temperature, and check his skin for hygiene. Everything is good on the up and up. All right, I'm going to have him take a seat here now, and I'm going to now listen to his posterior breath sounds, and I would have him take his shirt off and look at his and check all of his skin and everything in the back and the front. But for this, I'm going to let him keep his shirt on, but normally I would. Okay, I'm going to listen to his breath sounds. I'm going to have him take deep breaths while I listen to the 10 locations for breath sounds up on his back. Okay, go ahead and start taking deep breaths, please. Every breath sounds are normal. Okay, while I'm back here, I'm going to assess his scapula, his scapula and his spine to see if they are symmetrical and straight, that the alignment is proper. I'm also going to have him shrug against my hands. You shrug, and that's going to assess cranial nerve 11. Okay, now I'm going to move on to his anterior chest. I'm also going to do the same thing, inspect his skin and his muscles for alignment and symmetry in the front. Okay, and I'm going to listen to his breath sounds in the front. Okay, all right, take a deep breath, please. breath sounds are good. I'm going to assess his heart sounds. It's going to be the pulmonic. Well, in order, it would be aortic, pulmonic, the Erb's point, tricuspid, and the mitral. The mitral is going to be the point of maximal impact because that's where the S1 sounds are coming from whenever his ventricles contract. Okay, we're going to go to the second intercostal space, right sternal border for his aorta. Okay, and the opposite side, second intercostal space, left sternal border for his pulmonic. Okay, one intercostal space down is his Erb's point. One more down is tricuspid. And then you're going to go to your mid-sternoclavicular line and go down to the 4th to 5th intercostal space for the mitral. Alright, everything sounds good. That's also where you're going to get your apical pulse. You do that for a minute, assessing rate, rhythm, and I'm going to go ahead and do that now. Alright, 78. His pulse is rate is normal, rhythm is normal. Okay, let's see. And moving back up to his upper extremities, I'd have to check his pulses in both arms to assess if their rate and rhythm are the same. No abnormalities. Brachial pulse and radial pulse. Alright, both are good. Okay, now I'm going to have him lie down and I'm going to assess his bowel sounds. Bring the computer. Alright. Okay, we're going to start by assessing the skin all around his stomach to see if there's any type of abnormalities, lesions. Okay, and then we'll start by auscultating first. You always auscultate first before you palpate. So I'm going to start with the right lower quadrant to listen to bowel sounds. And you always want to listen for at least 5 minutes before you can note that you didn't hear any bowel sounds. So we're going to start now with the right lower quadrant. You're going to go up to the right upper quadrant. Left upper quadrant. Okay. Vowel sounds good. Sounds normal. Um, if you don't hear anything after 5 minutes, you can document that you heard no vowel sounds. But in his case, I heard some vowel sounds, so we're good. And now you also have to auscultate for any vascular sounds or bruits in his aorta, pulse, the iliac, right and left, um, the renal right and left, and the femoral right and left. But you're going to use the bell to assess for bruits. Okay, there were no bruits. I'm going to check for vascular sounds now in the same spots. Okay, which is good. And then you're going to lightly palpate in the same way. You're going to start with the right lower quadrant. You lightly palpate for any masses or anything that are a little more superficial. And lightly palpate here and ask the patient if there's any tenderness.
No pain.
No pain. Okay. We'll move along to the other quadrants. Move down here. Okay. That's good. There were no abnormalities. Now you're going to go and deeply palpate. Same, and ask for any tenderness.
No pain.
Okay. Next, I'm going to move to his lower extremities. I'm going to have him sit up. Okay, I'm going to have him move to this chair. Now I'm going to assess his strength and range of motion in his feet. I'm going to have him push against my hand. Okay, push and pull. Good. Same with the other foot. Pull, push. Alright, strength is good. I'm going to have him do the same thing with his legs. Push up against my hand. Okay, and then pull down. Alright. Same way. Okay, good. Pull down. Alright, good strength. Now I'm going to have him stand up. Oh wait, I'm sorry. Have him sit one more time. I need to check his pulses. We're going to check the dorsalis pedis, which is on the top of his foot. We're going to check them bilaterally. Okay, good. And then the posterior tibialis, and those are good. He also has a popliteal pulse that you could check, but I've already checked the lower ones, so they should be good. And it's hard to find the popliteal pulse. Next, I'll have him stand up so we can do a few exercises. We're going to move into the neurological now. We're going to have him do a few 2 balance exercises and 2 coordination exercises. For the balance exercise, I'm going to have him stand on one foot. Okay, stand on one foot, please, and see if he can keep his balance. All right, that's good. And then for the next one, I'll have him walk heel toe, just like this. There we go, heel toe. All right, his balance seems to be good. I'll have him come back to the original starting spot. And we are going to do some coordination. Okay, for coordination, I'm going to have him take his fingers and put rapidly put his thumb to his fingers, or connect them. There we go, good. And then now I'm going to have him close his eyes and rapidly take his fingers and put them out wide and bring them to his nose rapidly. Alternate. Okay, coordination is good. And throughout the whole assessment, I would have him. He responded to my sense of touch and everything when I touched him, and he responded. That also assesses his neurological. And then now I'm going to have him stand straight up here for me, and touch his toes. I need to assess his back, his spine for alignment. Okay, and palpate for alignment. All right, everything's good. Has a straight back, no signs of scoliosis. And I think that's good. Thank you very much.
Thanks, sir.
That was long.
Is that
That was
it?
like freaking 31, 32 minutes.
Okay.